I joined the team in 2017. I oversee basically all operations that are related to our value-based care or population health initiatives.
When you take a look at everything that their team accomplishes, you're kind of surprised to see how few people there are.
Our team is small. I think one of the challenges we face is, there's so much data. We have so much data that it could be easy to get really lost.
What the Nuvance team has been able to do with the data and the algorithms and the tools that Arcadia puts in place is cut through a lot of that process of searching for the needle in a haystack to really shortcut to that light bulb moment where you're able to say, here's the delta.
So it allows us to take this mass amount of information that we have at our fingertips and really make it actionable without needing necessarily an advanced degree in analytics.
I love the way that Nuvance really pushes us to innovate, because when one organization like Nuvance is able to come up with a new way of looking at this data, a new way of tackling a new and emerging problem, we're able to really quickly build that into our broader toolkit and roll it out across our entire network that allows us to ultimately reach over 100 million patients.
Whenever they create something, if it's an initiative that we are not yet focusing on, it automatically pushes us to know that this is something we need to move towards. This is important.
I think one of the most impactful initiatives for me has been the way that the Nuvance team has engaged with some of these new tools that we have around end-of-life care.
How do we identify this patient population that could potentially be appropriate for palliative care referrals? And in the past, we were using a process and, it required that manual labor of somebody conducting an evaluation with a patient on the phone.
What you have the opportunity to do in that space isn't just tackling costs, but it's really thinking about how do we support patients and their families in this incredibly vulnerable and challenging time.
At the center of it all is always the patient.
And it's such a great example of a spot where you're able to use this data and these really nuanced algorithms to understand what's the right time to start thinking about hospice. And how do we get that information in front of providers so that patients can really get the most out of those last days and weeks with their families? And for me, that's one of the most meaningful spots where you can make such a difference with the data.
I truly believe that what we're doing makes a difference not only for patients but with physicians. It makes their life easier, and it allows them to practice medicine the way that they wished that they could.